Hello and welcome back to the Gluten Free RN podcast. I'm Nadine, the Gluten Free RN. Today, during episode 60 of the Gluten Free RN podcast, I'm going to talk about hepatitis B vaccine and celiac disease. There's an interesting thing you need to know. Stay tuned. Welcome back, and thank you for listening to the Gluten Free RN podcast. Welcome to all new listeners from around the world, and to everyone who is a brand new listener, and also to the people that have listened to every single episode of the Gluten Free RN podcast. I really appreciate everyone listening, sending me emails, making notes, and also for the rating and the reviews on iTunes, Stitcher, Google Player, or wherever else you listen to the Gluten Free RN podcast. Welcome back. And if you have any ideas for future episodes of the Gluten Free RN podcast, please shoot me an email at nadine@glutenfreern.com. While I do my best to give you valuable information during each podcast, there may be some nugget of data or huge chunk of information that I haven't included. These podcasts cannot be super long, and they're not meant to be hours long. But hopefully, you will get started on your own celiac disease and non-celiac gluten sensitivity research journey by listening to this podcast and getting curious about what's going on in the world around us regarding these very important topics. I frequently finish recording a podcast only to remember an important piece of the puzzle that I forgot to mention in that episode. There's always more to know, more to learn, more to research, and more articles to review. Thank you for joining me on this really incredible journey of learning and reporting. So today I'm going to talk about the importance of finding out whether your hepatitis B titer is actually positive, which means that the immunization that you took for the hepatitis B vaccine actually worked for you. What we're finding is that people that were celiac or people that are celiac have a hard time with the hepatitis B vaccine. I'm going to reference several articles in the podcast notes, so if you want to follow along, I'm going to read a few chunks of those research articles so you understand what's in the research and why this topic is so important for those of us with celiac disease. But first of all, I want to go over what hepatitis B is. And I'm going to read this directly from the World Health Organization fact sheet on hepatitis B. Hepatitis B is a viral infection that attacks the liver and can cause both acute and chronic disease. The virus is transmitted through contact with the blood or body fluids of an infected person. An estimated 257 million people are living with hepatitis B virus infection, defined as hepatitis B surface antigen positive. In 2015, hepatitis B resulted in 887,000 deaths, mostly from complications, which include cirrhosis of the liver and hepatocellular carcinoma, which is liver cancer. Hepatitis B is an important occupational hazard for health workers. So doctors, nurses, CNAs, anybody that works in the healthcare field is particularly at risk for developing these infections if you're not immunized against hepatitis B virus, or if your hepatitis B vaccine did not take, which means your body is unresponsive to that initial vaccine. It is also noted that hepatitis B can be prevented by currently available safe and effective vaccine. Now I'm going to follow that up with reading just the abstract portion of the World Journal of Gastroenterology paper written in February of 2013. This particular paper says hepatitis B vaccine in celiac disease, yesterday, today, and tomorrow. This is a paper from a team in Italy, and I do include it in the podcast notes. The abstract portion of this paper says some studies show that in celiac patients, the immunological response to vaccination is similar to the one found in general population except for the vaccine against hepatitis B virus, or HBV. The non-responsiveness to HBV vaccine has also been described in healthy people. Nevertheless, the number of non-responders has been demonstrated to be higher in celiac disease patients than in healthy controls. Several hypotheses explain the higher rate of unresponsiveness to HBV vaccine in celiac disease patients that have been described, such as the genetic hypothesis according to the CD patients carrying the disease-specific haplotype HLA, B8, DR3, and DQ2. Show a lower response to HBV vaccine both in clinically expressed celiac disease patients and in healthy people carrying the same haplotype. Interesting. On the other hand, it has been demonstrated that the gluten intake during the vaccination seems to influence the response to the same vaccine. Moreover, it has been demonstrated a possible genetic predisposition to hepatitis B vaccine non-responsiveness likely due to the presence of specific human leukocyte antigen haplotypes and specific single nucleotide polymorphisms in genes of cytokine receptors and in toll-like receptors. But the pathogenic mechanism responsible for this low responsiveness still remains unclear. The aim of this review is to focus on the possible pathogenic causes of unresponsiveness to HBV vaccine in celiac disease patients and to propose an alternative vaccination schedule in order to improve the responsiveness to HBV vaccine in this at-risk patients. So this particular article is looking at how we deal with the hepatitis B non-responsiveness to celiac patients currently, and then ways that we might be dealing with it in the future. There's another Italian study entitled Vaccination in Celiac Disease, Results of a Retrospective Study, which says that the results showed that in celiac patients, the immunological response to vaccine is similar to that in the one found in general population, except for the HBV vaccine. And the conclusion being that the evaluation of immunological response to HBV vaccine should be regularly effectuated in celiac children and revaccination should be recommended. Now, most of these articles will say that hepatitis B is the only vaccine that is concerning, that people with celiac disease tend not to respond to it immunologically. But it is interesting to note that despite having had the MMR, or the measles, mumps, and rubella vaccine as an infant, I developed mumps in first grade. I distinctly remember having mumps because I was cast in the school play as a caterpillar that turned into a beautiful butterfly. The lead part, by the way, and I missed it because I had the mumps. But I didn't know that I was celiac at that point. As a first grader, I didn't find out I had celiac disease until I was 40 years old and had multisystem organ failure and was nearly dead. But here, in this particular instance, I had been vaccinated appropriately according to the vaccination schedule back when I was a toddler and an infant, but I developed mumps anyway. I have since learned and now know of other people that have had mumps despite being immunized also. Perhaps mumps is another one of those vaccines that needs to be studied a little bit more, especially in light of the celiac population increasing every year. By no means is this an anti-immunization or anti-vaccine podcast episode, not at all. I do, however, want to discuss a few areas of concern. My dad had polio as a toddler and suffered the effects of polio his whole life. I am a healthcare provider that is all for making sure that we are immunizing people appropriately against some of these childhood diseases or viruses. My current professional questioning opinion about immunizations is this. We are giving infants multiple vaccines at one time, and babies have an immature immune system. What are all of those vaccines doing to the immature immune system of these babies? Especially in light that many of these babies are undiagnosed celiac, or are immunocompromised for other reasons, which means that their immune system is immature or could be compromised for many different reasons. It's important to identify these children that are celiac or immunocompromised perhaps before they are immunized, so that perhaps they can be put on a different immunization or vaccine schedule, so that they're not getting as many vaccines at the same time. It seems like most of the information on the vaccines, especially in children, is coming from the World Journal of Gastroenterology. This particular article was released May 14th, 2017, and it is entitled Immune Response to Vaccines in Children with Celiac Disease. It also comes from Italy and is authored by Caterina Anania, Francesco Olivero, and Lucia Pacifico. So I'll just go ahead and read this particular abstract, and you can read along if you have printed this off or if you want to refer back to it. Again, the title of this article is Immune Response to Vaccines in Children with Celiac Disease. Celiac disease is an immune-mediated systemic condition evoked by ingestion of gluten and related prolamines in genetically susceptible subjects. The disease is featured by a variable combination of clinical signs, specific antibodies, HLA-DQ2 and HLA-DQ8 haplotypes, and enteropathy. Vaccination is the most potent intervention for infectious disease prevention. Several factors, including age, gender, ethnicity, quality and quantity of vaccine antigen, doses, and route of administration can influence immune response to vaccination, although the main cause of variation in the responsiveness among vaccine recipients is host genetic variability. So we're talking about those genes again. The HLA system has a fundamental role in identifying the antigens introduced into the host with the vaccines and in the development of specific antibodies. And some HLA phenotypes have been associated with a less affected immunological response. The available literature indicates that the immunological response to vaccines in celiac disease children does not differ markedly from that of the general population, and antibody titers are high enough to provide long-term protection, except for the hepatitis B vaccine. In this article, we review and discuss the scarce literature, which means there's not a lot of it, in this field in order to provide clinical practice guidelines to achieve the most efficient monitoring of the response to vaccines in pediatric celiac disease patients. In the same article, the conclusion states that the present evidence supports the good immunogenicity of vaccines in children affected by celiac disease with the exception of HBV, the hepatitis B vaccine. The available literature shows that HBV vaccine response is lower in subjects with celiac disease. Some authors hypothesize that the lack of response to HBV vaccination is related to specific HLA association, while others argue that exposure to gluten at the time of vaccine administration may be responsible. Nonetheless, non-responsiveness to HBV vaccination in celiac disease subjects is a serious public health problem because of the wide diffusion of celiac disease, which affects about 1% of the European population. And as we know now, we can extrapolate that out worldwide, and some populations are even higher. Consequently, new vaccination strategies have been proposed in order to reach complete protection, including administration of booster shots of HBV vaccine by the intramuscular or intradermal via. An evaluation of the response to HBV vaccine should be implemented as a routine assessment in newly diagnosed celiac disease who were previously vaccinated for HBV. When unresponsiveness occurs, revaccination utilizing the intradermal route determines a potentially higher immune response than the intramuscular route, even employing smaller doses owing to the direct delivery of antigen to the skin immune system. Moreover, revaccination needs to be done following the decline of specific antibodies, which commonly emerges after approximately 1 year of gluten-free diet. So there, we have some really potent information about the hepatitis V vaccine and celiac disease, and why it's very important for those of us that have been diagnosed with celiac disease to get a hepatitis titer done to see if we're actually immune. to see if those vaccines that we did receive actually worked for us because we have celiac disease and our immune system was damaged for so long, or even as an infant. And this is very important information for you to know and for your family, especially if everybody has celiac disease or several of your family members have celiac disease, and especially if you're a healthcare worker, because we're going to be more at risk for developing hepatitis, which is cirrhosis of the liver or inflammation of the liver, or unfortunately, some people will develop liver cancer because they don't know that they had celiac disease and they got these hepatitis B vaccines, which didn't work. So this is all about protecting yourself in just one other way and making sure that you have as much information as possible. Hopefully this information has been useful to you and to your family, especially if you're a healthcare worker, so that you can look at your patients differently. And if they were vaccinated with the hepatitis B vaccine, but their titer is negative for hepatitis B, those particular patients absolutely need to be tested for celiac disease. This is just another population to look out for and also to have a high index of suspicion for being undiagnosed celiac. I hope this information has been helpful to you and your family and your friends. Let me know if there's any comments or concerns, or if you found an article that you think I need to review, send it in. Send it to Nadine at glutenfreern.com. I will happily research or review anything that you send to me, and also read all of the comments and ratings and reviews of the Gluten Free RN podcast. Thank you again for joining me. This has been episode 60, reviewing hepatitis B vaccine and celiac disease. Stay tuned for more information next week on the Gluten Free RN podcast. I'm Nadine Griskowiak, the Gluten Free RN. Bye.